So I have the distinct honor and privilege of getting us started today and introducing someone who's been a good friend, good colleague, and a great mentor over the years. John Davis was former program director and now is the academic chair at Georgetown EM. He is a conference planning extraordinaire, and more importantly than that, just an amazing leader and speaker. And so he's going to start us off with Pearls and Pitfalls for you thinking about leadership. So, John, take it away.
Great. Thank you so much. It's really great to see everyone this morning. Can I just get a thumbs up from the back of the room? You can hear me okay? Excellent, excellent. Got a roaring thumbs up there. I tend to move around a little bit, and I will tell you, it is so nice to be back in person. Instead of looking at all those Zoom tiles as we did for the Chief Forum for the last couple of years, we're going to spend a lot of time today talking about leadership and pearls of leadership. And really, this is the foundation of your job as a chief resident. And it is a tough job day in and day out, but at the end of the day, it is such a gratifying experience. And the impact and the influence that you are going to have over the next generation of emergency physicians to follow you is really profound. And it extends into recruiting. You're going to hear about recruiting today. It extends into the interns and the second years, the third years, your co-fourth years if you're in a 4-year program. Really, it's an incredible position, an incredible an opportunity, and it's a great opportunity in leadership. Just letting you know a little bit about myself. So I trained at the Stanford program on the West Coast, and then I'm from Maryland originally and just had to get out of the state of Maryland. So I moved to California. I was there for 3 glorious years, took a faculty position upon completing residency training at Stanford. It was a 3-year program at the time, so I was a faculty member there. And then I met a girl from Maryland in California. So all roads led back to the D.C. area. And so I've been back, true story, my then girlfriend, now wife, and 2 kids later. I've been back in D.C. for 20 years now. And the reason I took the job that I did in D.C. is I had an opportunity 2 years out of residency to be a founding associate program director for a fledgling residency program. We had started building the Georgetown EM program back in 2002, 2003, and I had an opportunity, again, finished residency in 01, moved to DC in 02, and in 02 and 03 had a chance as a brand new faculty member to build a program. It was really an incredible experience, and I can tell you that starting out having a residency as you're building it with no residents, it was a really easy job in a lot of ways, right? There was never any conflict. But then I quickly learned as an APD for a brand new program, when you just have interns, and then you just have interns in second years, and then you finally have chief residents into that 3rd year, I had the opportunity to serve as the de facto chief resident for a 2-year period. And I learned so much during that time. I then went on to serve as program director, later as academic chair. In addition to serving as academic chair, I also have a health system role where I serve as the physician chair for graduate medical education. So I have an oversight role for 105 training programs, or 1,200 residents and fellows. So it's really been a learning experience. And a lot of what I'm going to share with you today is predicated on the mistakes that I have made and I continue to make on a regular basis. Because everything in leadership, it truly is a growth process. And if you think you've got it, you've got a lot to learn. Because there's going to be novel challenges. Look at the pandemic and the new challenges that the pandemic has given rise to. So important things to think about, and really kudos to Matt and Carolyn and the planning team. Really planned an exceptional day of content for you. So really, here is our goal for this first 50 minutes. We're going to talk about you as a chief resident being the boss that you would want to have. And in that frame, we're going to spend a fair amount of time talking about EI or EQ. Just by show of hands, who here has ever heard of or has any working knowledge of EI or EQ? So a few. Okay. Excellent. The numbers keep on going up year after year. This is something that's huge in the business literature and in the business realm. We're going to talk about that. And here's our specific roadmap for meeting those goals and objectives. We're going to talk about why this even matters. Then we're going to talk about EQ or EI, and we'll define it for you in a moment here. For the emergency physician, we're going to talk about some pearls and pitfalls. I love the top 10 list, and we're going to go through a top 10 list of pearls that will hopefully be helpful to you this afternoon, tomorrow, in the coming weeks, as you are tearing off on your chief year. and the conflicts, some of the things that you're going to deal with, hopefully will provide a frame. Now, with all this said, you can't learn any of this from Rosen's Emergency Medicine or Tinton Alley. There is not a great chapter in any of these textbooks on everything that we're going to cover today and everything that you're going to hear through the course of this Chief Resident Forum. But there is a lot of literature in other spaces. You get outside of emergency medicine. You get outside of the house of medicine. There's actually a ton out there, but it's not in medicine. It's in management. It's at business schools, in these other places, these other spaces. So it's really important. Again, I have no affiliation with Harvard Business Review whatsoever. However, I am a ravenous consumer of what they publish because it's great executive summaries on these leadership, these management topics. And you might not see yourself as a CEO of a company when you're a chief resident, but you're kind of like a CEO of a small company, or at least the chief operating officer. Your residents, your fellows, your interns, they're all looking at you for guidance and advice, and their daily work life is dependent on the decisions that you make, the interactions that you have with those individuals. So this is probably what you're thinking here. Yeah, I know. And by the way, the one on the right is from Wikipedia. The one on the left is actually my daughter. She's an ex-preemie. She's 4 pounds, 1 ounce when she was born. She's turning 17 this summer, so she's come a long way. She's still angry that I utilize this in like every presentation that I give. So why are we here? Leadership is all around us. We've been exposed to leaders, whether we've thought about it in this way or not, for our entire lives. Our preschool teachers were our leaders. Our coaches, if you were ever involved in any organized athletics, they were our leaders. What about managers? I had a job as a lifeguard. I had a job waiting tables. Those were leaders that I had in my life. Of course, our deans. When we're in medical school, our program directors, everyone sitting in this room, you have a PD, you have APDs, you have other folks in your department, your chairs, GME, hospital administration, and finally, you. You're here to learn about leadership. So we're going to start with a non-scientific poll, and I want everyone to participate in this poll, 100% participation. Have you ever worked with a leader who just doesn't seem to get it? If you answer yes to this question, go ahead and raise your hand. Raise your hand proudly. So I can tell you every single time I ask this question, 100% of the hands come up. But what is always disconcerting to me is coming from Georgetown Emergency Medicine, when I see our 3 rising chiefs from Georgetown EM, their hands go up, higher up than anyone's, right? Have you ever worked with a leader? And I'm like, my goodness, are they working with me who just doesn't seem to get it? The point is that everyone has worked with a leader at some point who just doesn't seem to get it. Matt warned you that this would be interactive. We're not going to ask you what these answers are, but I want you to write down, jot down, or at least think 1 or 2 characteristics of leaders that you've worked with at some point, either at a job or otherwise, who just seem to not get it. They just don't seem to get it. What are those characteristics? What was it? How can you frame that in a word or two for a leader who didn't make you feel great in working with them? Now, I want you to contrast that with this next question. What are a few of the characteristics of leaders that just seemed to get it? They understood. They made you feel welcome. They made you feel valued. They made the team achieve better outcomes than could have been achieved otherwise. What are those 1 or 2 characteristics? I want you to jot them down, at least think about those characteristics. So we're not going to ask you to share what you wrote down, but you know in your mind, you're starting to develop that deck. Leaders that really inspired me and other leaders who didn't make me feel great. I can tell you, if you take nothing else from this talk, emulate those behaviors of those who inspired you and avoid the behaviors of those who didn't make you feel great when you were working with them. And I can tell you that, and I'm not going to ask for everyone's specific details, But most often, people focus on emotional aspects of their leader rather than tactical. Meaning, when I used to wait tables at Hamburger Hamlet in Gaithersburg, Maryland, back in 1993, I don't remember how many shifts I was scheduled for, whether I got that weekend off or not. I do remember my manager looking at me and saying, we hired you and you seem to have never really done this before. Let me teach you how to manage 5 tables at once and make sure you get everything right to keep the experience for our customers top notch. Because that's going to benefit you, that's going to benefit us. Those are the type of things that we remember. The tactical, we don't tend to remember. The emotional aspects made me and others feel valued and inspired. Or the negatives ignored me, or other members of the team played favorites. These are the things that you want to avoid. So this all brings us to emotional intelligence. EQ, EI, several different terms for it. There's been a ton that's published on this in this space. Daniel Goleman out of Harvard, several other resources, a lot that's out there. You can Google emotional intelligence, get a lot of good resources out there. It's a marginal factor that can have tremendous impact. We talk about marginal factors. I love marginal factors, these tiny things that are kind of like lever points. They make a big difference. And I learned this from one of my colleagues, no longer practicing clinically now, but for years, he was the team doc for the Washington Commanders, formerly known as Washington Football Team, formerly known as the Washington Redskins. And the Redskins, I can tell you, I grew up outside of D.C. I've been struggling with the Washington Football Team and the Commanders for decades. They have not had a great season, but they always seem to recruit good players. And so I always used to say to my colleague, John DeSimone, I'm like, John, what's the deal? How come this team can't seem to get it together? And his response was always the same thing. I've been an NFL doc. I've been on the sidelines. I've been in the locker room. I work with these folks day in and day out for 8-9 months a year. They're all great players. They were recruited from some of the best universities and best university programs to be a member of this football team. But I can tell you what makes a difference in an NFL game, it's usually a couple of plays. The teams that are at the top seem to figure out how to score in those last 2 minutes of the game when everything's on the line. Look at Tom Brady. Look at others. Again, I'm not a big fan of certain sports teams coming from Washington, D.C., but people just seem to figure out how to get the job done. Marginal factors. It's not every single play is better. It's a few plays at key moments that really get them over the finish line to victory. So this is a really important factor for CEOs. They've done a lot of studies of chief executive officers of Fortune 500 companies. Who are the successful companies in terms of market and revenue and all of these other things that shareholders look at in a marketplace on Wall Street? The CEOs that really understand their people, really understand their workforce, really understand the emotional impacts of the jobs are the ones that are successful. So EQ, there is an innate baseline. Some people just get it. We've all been exposed to these folks, right? They're just kind of like politicians, if you will, right from the get-go. They were running for class office perhaps in like 6th grade or whatever the case. But the good thing about EQ is it's something that can be shaped, refined, adapted, and molded over time. And the key thing is feedback, but more important than feedback is actually being receptive in listening to feedback. This is a huge pearl. When you're doing this sort of diagnostic biopsy, if you will, utilizing that medical term about the mood, the sense on the ground, when you're ready to implement a big change as chief, really pay attention not only to what you hear people saying, but also to really just understanding what they're telling you through their body language, through email correspondence, other things. And we're going to give you very specific, tangible examples here. So we're all educators. This is looking at EQ and the domains and the competencies. At the end of the day, the one that really matters and you really have to focus on in your role as chief is relationship management. If I had to distill leadership down to one term, conflict management is often it. It doesn't mean you're just managing conflicts with schedules, although I will tell you in the coming year, you're going to manage conflicts with schedules. That's a huge part of the job. But any leadership role, it's managing through conflicts. As a hospital administrator, as a hospital leader, you manage conflicts with leaders of the organization. You manage conflicts between departments. You manage all these things. It's what you do as an ER doc. You're managing conflicts. You're trying to engage consultants. Sometimes you have conflicts with consultants who are like, nope, we don't need to come down. And you're like, I'm advocating for my patient. I need you to come down and take care of this. That is a conflict. So this conflict management is really, really important. We're going to talk about these other competencies in the EQ space as well and how you can harness this information to really benefit your team and ultimately your program and your role as chief. So now let's focus specifically on ED leadership, your role as an emergency medicine chief resident. And I'm going to frame this, as I said from the get-go, as a top 10 list. I love top 10 lists. We're going to do the top 10 pearls and pitfalls. As I said before, this is predicated on mistakes that I have made and mistakes that I continue to make. I am persistently humbled in the process of dealing with individuals and dealing with conflict and maneuvering through all of these different channels and pathways. I can tell you the COVID-19 pandemic has been absolutely enlightening in so many ways because it introduced novel conflicts. We thought things were challenging before, then you introduce a global pandemic, and wow, things are really, really challenging on top of that. So point number one, just to launch into these points, we got 10 points. Matt tells me we have 3 hours. No, only joking. We got another half hour here. So let's launch through these points. So point number one, file this one away. Support those whom you empower. In your role as a chief resident, you are going to be empowering others to do many things. And you need to support them when you empower them. And I'm going to give you a specific example of this related to the chief role. So let's say your first month as a group of chief residents, you take all the time in the world crafting the perfect schedule. Undoubtedly, someone is going to be unhappy with that schedule. No question. You can count on it 100% of the time. Now let's say a resident is unhappy with their schedule. They know that you as the chief residents crafted that schedule, and they're going to jump right beyond you. They're going to go to the program leadership. They're going to go right to the PD. Maybe they have a semi-annual evaluation coming up. They're going to go right to one of the APDs. Perhaps they have a close working, mentoring relationship with that APD. Let's say that individual, a site director, an APD, a PD, hears the information from the resident who is displeased with their schedule that you crafted, and then the PD, the APD, or site director overturns the decision that you have made. How does that make you feel as a leader? How does that make you feel as a part of a team when you put sweat and tears in just trying to get this schedule right and someone's overturning it? So think about that frame. Now, there's important nuance here. With all these things, there's nuance. There's issues of law. My wife's an attorney. I always try to get the issues of law in here, and then there's issues of fact. So issues of law. Let's say in crafting the schedule, you're new to your chief role. You crafted the schedule, and you didn't recognize one of the duty hour non-starters that you can't cross that line. You just didn't recognize it. And why? It's your first time doing the schedule. And a resident goes to the program director and says, listen, this will violate duty hours. I've gone to the ACGME website. This is not right. The program director in that circumstance, that's an issue of law. That's non-negotiable. They have to overturn that. But what's the method that they overturn that? They should come to you, and there'll be a point to this and what you can do. They should come to you as the chief and say, hey, listen, I'm the program director here. I have to overturn this. I'm not going to email this individual yet. Do you all want to deliver the news that we all spoke together and you can tell them? That way you can still own it. Versus an issue of fact where it's kind of like this gray zone. It could go one way or the other. You always need to side with the individual that made the initial decision when it's an issue of fact, when it's a gray zone. When this becomes important is when you're empowering your residents, whether it's a junior resident, whether it's one of your senior resident colleagues, to do something. Whether it's planning graduation, whether it's planning a part of the curriculum, whether it's planning a social event, whatever it is, provide guardrails and empower them to make decisions and stand behind those decisions if issues were to arise. And that brings us to point number two. embracing that difficult conversation. Who here in their medical school curriculum at any point had a conversation or had a educational module, I should say, regarding difficult conversations with anything other than patients? Difficult administrative conversations. What about your role as a resident in your current program? Has anyone ever covered this area? The point is that we don't typically cover this in the medical school curriculum. We don't cover this in the core competencies of emergency medicine. Why? It's just not part of it, but it's incredibly important to leadership and to your role as chief. I'm going to give you a specific example here of how no conversation, although it feels better, none of us went into this job to have persistent conflicts. Sure, we have conflicts with patients at times in terms of the expectation gaps and things of that nature, but we didn't go into this job to have conflicts with colleagues. But when you're owning someone's schedule, conflicts arise. And so a specific example of this, a good friend of mine from medical school, she's a pediatrician, did pediatric training, 3 years of residency training in pediatrics, worked at a primary care pediatric group affiliated with a large teaching hospital, always liked working in the ED, so would do some shifts as a general pediatrician on the pediatric side of the ED, supplementing the ER docs and the PEM docs they had working there. But had this idea, since she loved emergency medicine, but didn't quite want to do a PEM fellowship. She's like, I don't want to invest another 3 years doing a fellowship at this point. But I have this idea because I see a pain point. And some of the best solutions are when you identify pain points. An important thing to file away. Keep that in mind, identifying pain points. What are the pain points for your residents, for your interns, for your faculty that you as a chief resident group can help to address? She said, a pain point I've noticed in the primary care pediatric clinic is that there's a lot of unscheduled care. We're responsible for taking care of this cohort of X number of patients. I have 12 faculty members. They all have busy clinic schedules. But when the kids with fever come in early in the morning, it kind of disrupts the schedule. And then the well child visits, they're waiting longer, they're upset. It kind of bounces things all over the place. So I had this idea, and I went to my chair of pediatrics, true story, and I proposed something that would solve this pain point. She said, I don't like doing the primary well child visits as much. Why don't I shoulder the burden for all 12 of our colleagues, and I'll do all of the acute visits that come to the clinic? It's kind of like working in the ED, in a sense. It's unscheduled care. It will solve a pain point, and all the other doctors in the group would be like, this is fantastic. This solves a problem because this totally screws up our schedule. It makes it really hard for us. Her chair said, that's a great idea. Let me get back to you in a couple of weeks. A few weeks later, again, true story, she gets an email in her inbox from her chair announcing the creation of a new position, which was the director of unscheduled care, acute care in this pediatric clinic. And the director was not her. Chose someone else. What do you think she did at that point? Started handing out her CV, looking for other jobs, went to another health system. Within 3 months, was at another health system. And I was speaking with her, and I was like, Amy, how could this have played differently where you would have stayed with the organization? She's like, if my chair would have called me in and said, great idea, I love the idea, I think we're going to go for it, I'm going to put a call for interest in those who want to apply, and you're going to be one of those individuals, or I have someone else in mind for this position for these reasons. She said, I wouldn't have left you, or I would have been upset, but at least they would have showed me the respect to have the conversation. The reason why I'm leaving is no one had the respect to have the conversation with me. And so I bring this up as this goodwill, bad faith distinction. It might be easier in the moment to kind of sidestep and be like, well, they didn't reach out to me. I don't necessarily have to reach out to them. Everything must be good. That can lead to bad faith. Always have the difficult conversation. And when you have that difficult conversation, it leads to goodwill. Even if a decision is not in one's favor, they'll appreciate the fact that you respected their position and you value them enough to have the conversation. So always remember this goodwill versus bad faith distinction. Point number 3, placing yourself in others' shoes often. How would I react to this conversation? Think about this with every single email that you craft, every decision that you make. from this point forth, as you're entering the next academic year, you are a chief resident. Everything that you say, everything that you do, every correspondence that you have, all of a sudden takes on more weight and more meaning to every individual that you interact with. You might not necessarily see it that way, but standing shoulder to shoulder with your colleagues, everything that you do is going to take on more pertinence in everyone else's mind. So think about your communications. And I'm going to give a specific example of this. I'm not going to out the names of these individuals. And in fact, this has nothing to do with medicine. This all has to do with my home life. So I have a nearly 17-year-old daughter. My son is 13. When my son was in first grade, my wife said, listen, you got to help out with Cub Scouts. And I'm like, honey, I'm not a camper. I'm like a Hyatt person. I'm very comfortable at the Marriott across the street. Like I'm not like an outdoor person. She's like, listen, but you're not an athlete either. So you have to do something with the child, all right? Spend some time, like do something. So I'm like, all right, I'll do Scouts. So I show up at the Scout meeting, and they're like, great. A father of a first grader, the first one to show up early, you're the den leader. And I'm like, whoa. What do you mean I'm the den leader? Like, the first one to show up? That's our rule. Sorry, here you go. You're anointed den leader. So I'm like, well, this is, fantastic. I'm not a camper. I'm not a fisher. I'm not a hunter. But it's a group of first grade. I can handle this. I can do this. So I was dutifully doing my duties as a den leader for several years. But then all of a sudden, one Saturday morning, and I think my son was probably in like fourth grade or so at this point, I get an email from one of the other Cub Scout leaders. No joke. This is a real email. Hey, John, this month's advancement deadline was Wednesday at 8 p.m., and this is Saturday, and you still haven't contacted the advancement leader. Were you planning to pick up this month's We've Won Awards Castaway on your own? Since you would need to go to the Scout store to do that, I'm wondering if you wanted to coordinate with Peter and Jason to purchase the whole PAX awards for this month, and I'm CCing the PAC leader for comment here. Sincerely, so-and-so. Now, you can imagine my response when I get this email on like a nice, comfortable Saturday morning. So let's dissect this email a little bit. So first and foremost, what's going on in my world? And this is important to think about what's going on in the world of each and every one of your residents at any given time. For me, this was a busy clinical stretch. I had a robust administrative baseline. The individual didn't know that. They know nothing about clinical medicine, but I had a really busy stretch, and I had a really thorny personnel issue, not in emergency medicine, but in another specialty from a GME perspective that we were dealing with. So I was kind of not in this great, grand place where I can just pounce on something on Wednesday to make sure the awards were in. Second issue with this email, there was really no opener. Important, we're going to talk about it as we dissect it further. And in addition, there's really no closer here as well. The use of shaming. Like, you didn't do this, you didn't contact anyone, like, what's going on here? You have failed us in your role as a den leader. Good use of questions, and I think questions are always a good thing to use, but really not the right tone. It's kind of punitive here. Like, yeah, I'm just gonna, you just do everything now. Like, you've messed this up, you go ahead and take care of everything. And by the way, I'm CCing your boss on this. So you can imagine how I felt. So my first response was just to start typing back. And my wife's sitting next to me. She's like, what on earth are you doing? She's like, you look like angry about something. And I'm like, this email, you would not believe this email I just got. And she's like, just stop. Stop. Take a deep breath. Practice what you preach. All right, dude? Just chill. Chill out. Rules of engagement. Self-embargo, deep breath, namaste moment. Right? So what I did for my own therapeutic purposes, in that next hour, instead of just writing an email back, I thought, let me try to make a silver lining out of this. What type of email would I have suggested crafting in this moment? And this is what I came up with. Exact same message, but listen to the tone. Dear John, with an opener, thank you for all that you do to contribute to the Scouts. Think about that with your residents. Thanks so much for all you're doing. Thanks for covering that extra shift last week. Thanks for being flexible with your schedule. Always open with a thank you. It's so funny as a side note. I have my seventh grader, Matthew. He starts every email to every teacher with an opener now. He's like, I hope you're having a great day. And he always ends it with some type of closer. So utilize this. It's really, really helpful. Now, number 2, I know that you must be super busy. You can use this line in each and every one of your residents and know that it's factual 100% of the time. So wanted to check in with you regarding the advancement awards that were due this week. Recognition of life as a busy professional. Next, benefit of doubt. Always give benefit of doubt. Always give people the opportunity to be heard. I can't tell you how many times in my system GME role, we get an email, a note from a program director in a given specialty. They're like, you cannot believe what this resident did. You cannot believe what this fellow did. And our first response from a GME perspective, did you talk to them and get their side of the story? Well, no, I don't need to get their side of the story. Everyone told me. I saw it on social media. Talk to them. Get the other side of the story. Always give people the benefit of the doubt. People are reasonable. Even if it's the most egregious thing you could possibly imagine, there's always a second side of the story. One of my mentors, who I work very closely with in GME, she always says there's actually a third story. There's one view, the second view, and then there's the truth, which can be somewhere else. But at the end of the day, you want to get to the bottom of things. You want to hear out people. Also, so if you have already forwarded to Peter, just let me know. Kindly disregard this email. Also, if you were planning on picking up the awards yourself, we would be grateful if you'd be willing to pick up all of the awards for the pack at the same time. Instead of a punitive tone, you're actually looking for a win-win. Like, how can we help us out, each other out? Like, if you need to get that, we need these other things, let's do this together. Let me know the best way to proceed. As we are on a really tight timeline, wink, wink, reminder, we can't wait 3 weeks for you to get your schedule requests in. You have to do this soon. If you could contact Jason, the boss, who's CC'd, being very transparent here, I'm CCing him, or me today, it would be perfect. We really need a response from you right now. And then the closer. Thank you again. We are greatly appreciative. Best regards, Nate. Think about how I would have felt. I know how I would have felt if I received this versus that first email. Think about this with every single correspondence that you send in your role as a chief, whether it's your own residents, whether it's chiefs of other programs, whether it's leaders of other programs, wherever you're interacting, remember, always give that benefit of the doubt. And even better, this is the rule that I picked up about a decade ago. I used to spend hours crafting emails. Hours crafting the perfect email. And you know something? At some point, I just threw it out the window and said, if I'm spending more than 7 or 10 minutes crafting an email, I just need to pick up the phone and call somebody. Because there is no way I can convey the nuance that I'm trying to get across in spending 3 hours in writing this email in 2 dimensions. I'm just going to pick up the phone and call. Now, there are times you need to craft that masterful email. When it's going to a group of 30, 40 people, of course, you need to spend time. You need to run it by other people before you send it out. But think about picking up that phone. So this is what communication is all about, right? Getting that message. And you're ultimately trying to drive action, outcome, behavior. And if you don't get it right, no one's going to hear what you're trying to get across. All they're going to do is react to the message. Really, really important in crafting those communications. And that brings us to the treachery, point 4 of e-communications in general. The intent doesn't equal the interpretation, whether that's the 2-dimensional email, text messages, tweets, the power of in-person chats, and self-embargo before you hit the reply. I'll give you a specific example of this regarding a lost ski glove in a few slides, a few points from now. Continued, e-communication. We got a couple of slides dedicated to e-communication. Use with caution, CC. It is a great way to piss people off. You CC someone's boss. You CC your program director on everything. You need to CC each other. No question. As a group of co-chiefs, the other co-chiefs should be CC'd 100% of the time. Know why? Because you're acting as a chief unit. There are no pores. There is no triangulation. There is no good cop, bad cop. It is a unit. A decision from one of us is a decision from all of us. Get in the habit of always CCing each other as part of your chief unit because you speak for the group. BCC. I am still confused 30 plus years into email regarding BCC. I get BCC'd on things all the time. And I'm always confused. Well, if I reply, will that go just to the individual who is BCCing me or go to everyone who doesn't know I've been BCC'd on this email? I never use BCC. It scares me. It worries me. It's dread. I forward things instead. If I want to reply to that individual, I forward it and type their name fresh in that email inbox. Really, area of treachery. autocorrect, abbreviations, real text, captured from my wife's cell phone, identified by my daughter who was 12 years old at the time. My wife was not very facile with various abbreviations. She sent to her boss at work, the firm she works for, WTF. And her boss is like, what? What are you saying to me? And my wife's like, Wednesday, Thursday, Friday? So my daughter's like, you need to write an OMG in there. All right, just throw in an OMG. So masterful engagement. I thought this was fantastic. Like I try to consume this stuff that comes like Apple News feeds. I saw this one come across. It talked about the one-word email that Tim Cook, CEO of Apple, utilized that totally just engaged his team. And I was like reading through. I'm like, what is that word? Thoughts. Replied to an email and said thoughts. Like, what do you all think about this? Like, I am not the master puppeteer here. Sure, I'm the CEO of the company, but I'm only as good as the team is good. What do you guys think? What do you gals say? Like, what's the deal? Like, how can we make this better? What are your thoughts about the best way to proceed? So really, really great way to reply to emails. And I utilize this frequently. Like, even after a 5 to 7 minute email, I'll put thoughts, question mark. Like, if you have any other ideas, anything that I'm missing, anything that we're not hitting on, we are open to your feedback to hear more about it. And that brings us to point 5, actively managing change. Change is tough. It's human nature. No one likes change. Cats, I have 2 cats. Like, cats don't like change. Like, we bring them, like, down to our vacation home, and they're, like, offset for several hours until they then settle in. People, humans, animals, nobody likes change. So it's really, really important to recognize that change isn't an email. I've made this mistake multiple times. I can't tell you how many times in my career, like as an APD, as a program director, as an academic director, I sent out an email thinking like, whew, just made the change, right? Just ripped off the email. It's all good. Everything's good. Change is a process. They've actually done a lot of work in the management realm, in the management space. There's several different models of change. Most of them have at least 8 steps to change. 8 steps. The email is one tiny step in the middle. So remember that it's a process, and you have to actively manage it. You have to engage stakeholders. You have to pre-vet those contentious issues. Never underestimate the impact. I'll give you a tangible example of this. We work at a large health system. We have 9 emergency departments. One of our clinical chairs was asked by hospital administration to trim down hours, and this was like 5, 7, 10 years ago at this point. Trim down hours a little bit. They said, listen, like each of the docs that are working, we know they're working hard, but we just like to keep their patients per hour more consistent with our other 8 shops. I don't know the best way to do it, hospital administration saying this, but you need to talk with your team and figure out a way that we can be more sustainable and more consistent with our other shops, not only nationally, but what we're having in our health system. So this chair, true story, came to the faculty meeting and said, listen, we got this ask from hospital administration. This is what we're going to do. I'm going to cut the red team. We have a blue team, we have a green team, we have a red team. Like, the red team's gone. You can imagine how that went over with a group. All of a sudden, we had nocturnists who worked on the red team. We had people that enjoyed working on the red team for this, that, and the other reason. At the end of the day, all the care teams were equal, but it was a change. It was a change people weren't ready for. And that faculty meeting, I was at that faculty meeting, was a total disaster. It was a total disaster. And to the point where the chair just said, listen, we just got to back off here, and we'll come back next month. Let's talk about this further. So what he did is he came back the next month, true story, came to the faculty meeting and said, all right, here's the outcome that we need to get to. We've been told by hospital administration we need to reduce our hours by 7 to 10%. I have a few thoughts about how to do this. I don't know the best process to get us there, but this is the end point. This is where we need to end up. I need everyone in this room to come up with thoughtful suggestions of how we can get to this end point. The way that we're going to do it, let's take a half hour out of faculty meeting. We're meeting for the next 2 hours. Take a half hour, just get into focus groups, 2 or 3, however you want to do it, divide up, and let's all pull back together for the half hour after that and discuss solutions. The group came up with the solutions. The group came up with the solutions that were palatable. Why? Because they were the group's solutions. Everyone was invested in the process. It got us to the same outcome, but it wasn't this top-down, this is what we're going to do, like it or leave. It was a bottom-up. It was organic. Think about the power of that when you're interacting with your residents. When there has to be a change to the intern curriculum, engage the interns in that decision-making process. Tell them what the outcome needs to be, but we need you to be part of this decision-making process because there's no one that knows the intern year, using that example, better than the interns who are going through it. So an important thing, that biopsy, that temp check, that heads-up method, I utilize this all the time. If we were to think about this, what would you think? Use that with the second years. Use that with the first years. Use that with your co-senior residents. These are some of the changes that we need to make to the schedule or otherwise. How would people react to this? What are the unintended consequences? How could this come back and bite us? How could this hurt or help our team? Listening. This can be tough for an emergency physician. I can tell you it's tough for me. You know, like you hear that lengthy medical student presentation and long presentation going on for a while. Yes, I got a lot of things. I got EKGs whirling at me. I got a team to manage here. I got a couple of residents, got a couple of other students. I got nurses. I got, let's speed up things. We're ER docs. We have been trained and conditioned for 3 or 4 years to make quick and effective dispos. So there is no better way to go into an administrative space as a chief resident to make quick and effective dispositions. Absolutely not. Administrative space is entirely different. And you have to unlearn every behavior pattern that you've been taught and conditioned since you were a fourth-year medical student deciding going into emergency medicine. You have to decondition yourself because effective management is the furthest thing from a couple of quick dispos. It takes time. It takes input. It takes biopsies. It takes thought before. It takes following afterwards for unintended consequences. Listen, gather intel, reflect, and decide. Resist the urge to hyper-reply to emails. I'll give you a specific example of this. I'll also give you a specific example. Back in the year 2012, 2013, it was one of my years when I was program director. I show up at conference, and conference is usually a happy time. People are happy to see one another. Folks are coming in from off services, and everyone gets together this one point a week. I show up at conference, and the mood was different. I could feel it in the room. And as a program director, walking in and kind of seeing the mood being different, I'm like, this ain't good. And then I see people kind of swirling and talking in groups and looking over at me, then looking away. I'm like, this is not good. So I pulled together my APDs, my senior APDs, and I'm like, hey, is there something going on? They're like, we've heard whisperings about something, but no one's really come to us and told us. I'm like, I don't know, I'm just going to get myself a Danish and kind of hope for the best here, right? And so I'm standing there at the back, and conference is over, like our academic hours are over, and I'm standing there at the back just waiting for what was going to come next. All of a sudden, I get like a rush of 4 or 5 junior and senior residents, and they're like, we need to talk with you. And I'm like, well, this is not good. So I said, okay, what do we need to talk about? What's going on? How can we help you? The issue was, it was May, and graduation, no venue had been identified yet. Why? Because the second year said they would identify the best venue ever in the history of EM graduations. But they were busy. They were in their ICU months, and they didn't realize that all of a sudden it's April and it's May. My golly, we haven't found a venue yet. The seniors who were expecting from their juniors the best graduation known to humankind found out that there was no venue selected. And you know something? Every cool venue was already booked because graduation was like 3 weeks away. Major issue. So what was my response? In this moment, I have a whole team of angry people around me. What are you saying? I want you to remember this line. Because I came up with it in the moment, but I'm like, I'm going to hold on to that because it seemed to diffuse the situation. It seemed to turn down the volume. I'll get back to you shortly. Standing here right now as the program director, I can't tell you what the answer is going to be. But what I can tell you is, I hear you. This is a problem for all of us, and we need to fix it, and we are going to work together to find an effective solution. And we did. Had a fantastic graduation, to the point the seniors were like, that was awesome. Thank goodness we found a great place. Keep that in mind. We're used to hyper-replying. We're used to giving quick dispos. Doctor, do you want another dose of epinephrine or not? That is what we're used to in the clinical space. Administrative endeavors rarely require the same beat-to-beat variability that clinical care does. Take a step back. We'll get back to you. You can't wait 2 weeks to get back. Their urgency is your urgency. Your urgency should be your team's urgency. But at the end of the day, take a step back and get back shortly. So that learning to listen. Beware of the holidays. Point number 7. This is a lesson that I learned. My first day as program director, my chair at the time, Mark Smith, said, listen, I'm just going to warn you. The one thing, I'm like, do you have any advice? I'm taking on this PD role. I've been an APD for several years. Like, what do I, he's like, just beware of the holidays. I'm like, well, what do you mean by that? Beware of the holidays. He said, hey, just trust me. It's like, it's a tough time of year. I'm like, oh, great. And, I guess it's April. I got a couple of months before I really have to deal with the holidays, whatever that means. But he's so incredibly right. Winter is a tough time in the academic calendar. Think about it. We start July 1st. We end June 30th. Short on sun, long on, especially if you're on the eastern seaboard, inclement gray weather. The glimmer of that fresh start of July when interns are arriving, everyone's been promoted, we have graduates, has worn off. The road to June, when you're sitting in December, January, seems distant. Everyone's working hard over the holidays. It is a time and an area that requires additional sensitivity. The reason I bring this up, if you're trying to enact change, when do we typically do change? For the second half of the academic year, starting on January 1st. Not the best time. I have a general principle. I try to avoid any major changes from November 15th to January 15th. Not always possible, but try it. And if you are going to make a change on January 1st, make sure that you pre-vet it back in October or November. Because if you start trying to have those conversations, you run into the HALT principle. Hungry, angry, lonely, tired. Be particularly mindful of this with change. Particularly mindful and around the holidays. What you can do always is listen. That's a huge part of your role as a chief, is to listen and express empathy. You've been there. You've done that. You've been an intern. You've been a second year. You are currently a senior resident. You know what people are going through. You can be empathetic, but what you can't do is fix everyone's problems. You can't fix everyone's woes, but you need to be able to listen. I don't know if this video will play. We'll try it
So
here.
you guys grew up together?
Yeah, since 3rd grade. What are you looking at?
I'm not looking at it.
We're not good enough for you. You looking for something else?
No, I don't know.
What are you, big supermodels? Oh, yeah, us. Supermodels. What do you model? Gloves? What are you doing? The girl's totally into me. Brad, eat a Snickers. Why? Because you get a little angry when you're hungry. Better? Better. So, ladies. So, losers.
Stacy, relax.
I'm sorry. You're not you when you're hungry. Snickers satisfies.
I thought it was a great commercial illustrating the HALT principle. So, point number 8, we're almost there. Step back from those emotional triggers. What do I mean by this? When we're working clinically, we see someone grasping their flank and they're kind of shuffling, writhing in pain. What do they have? Kidney stone. If they're elderly, we think about AAA. We're wired with this pattern recognition. Same thing happens with administrative decisions. You will have these pre-fabulated responses, recognize it or not, when people come to you with issues, such as, we want to talk to you about how many clinical shifts we're working this month, or the number of weekend shifts and the inequities in how these weekend shifts are distributed. It's important in these moments not to just react. Same principles as before. Take that step back, analyze, sound rationale. We'll look into this. We'll get back to you shortly. How I exemplify this, I can tell you, as a program director formerly, I was sitting on a ski lift. It was a really cold day. I feel a little vibration in my shoulder here because my cell phone had a new message. I pick up the message with my gloves on because it's really, really cold. I see the context of the message. I rip off my glove to start replying. The glove goes down. I ended up going down a really long run with no glove on a really cold day because I was trying to hyper reply to that email. Avoid the urge to hyper reply to emails. If anything is ever so important that you need to rip off your ski glove, utilizing that metaphor, and reply in that moment, don't reply. Pick up the phone and call. If anything is that urgent, you need to pick up the phone and call somebody. Most emails, and you can always do I'll get back to you shortly. Give me a few minutes to process. I had a great example of this just the other day where one of our vice chairs, clinical vice chairs, we had an academic, not issue, but something that we were trying to promote from a residency perspective. I sent this individual an email regarding scheduling of our various attendings and their ability to work with our residents as a core faculty member. This faculty member emailed me back and said, I need to talk with you about this tomorrow, some of the challenges from my perspective. And I said, I'm actually available to talk now. I'm just dropping off Matthew at swim. I got a little bit of time now. He's like, nope, I'll talk with you tomorrow. I spoke with this faculty member the next day, one of our vice chairs, and he's like, you should have seen the email I initially wrote to you. I'm like, oh, like, we're friends. And I'm like, what do you mean? He's like, oh, I was fuming mad when you sent that. He's like, but I took the night, and I'm cool now. We can have a good conversation. We had a good conversation. We got to a good outcome, but he self-embargoed before he hit that reply. His only reply was, we need to talk about this. Do you have time to carve out tomorrow? Great way to diffuse. So don't just react. Take a step back, analyze, sound rationale. Be reasonable, transparent, and consistent. If I can give you any pearl from a leadership space about dealing with a program, dealing with your residents, dealing with schedule, it is always be reasonable. Communicate your rationale. Others might not like the decision, but genuine, sincere, and sound rationale are key. Be transparent, crisp policies and procedures, and apply them 100% of the time. If you're finding that you need to do variances, more often than not, you need to change your policies to reflect those variances because there's no longer variances. They should be routine. One of the key things I need to do for one as I do for 29 others. We have a program of 30 residents. I utilize that frame many times as a program director. I recall getting a call from one of our residents, again, this is close to a decade ago, who said, why am I working on Christmas Day? I don't understand why I need to work. All of our residents aren't working on Christmas Day. And I kind of walked them through, like, listen, we each do 2 of the 3 holidays. I'm working this holiday as well. Our faculty work these holidays, our nutrition staff, our service associates, our radiologists. We're a full-service hospital. We all need to be there, but you don't need me there that day. And I said, listen, at the end of the day, I hear what you're saying. It's tough for all of us to work on holidays, but if I say, no, you don't need to work this day, I need to say that equally to 29 other people. And if I say that equally to 29 other people, you know something? We have no one there for the holidays. That does not make us critical members of this team. And my goal as a program director, your goal as a resident, is to make sure that we are indispensable to this circuitry. We want people saying, we need more of you working here, not, they're not here again. So think about that principle. What we do for you, we have to offer to everyone else as well. So here's a little split screen, still action photography of like before I started as a residency leader and after. Interestingly, my kids take credit for the hair. You know, my daughter in her health class has learned about like pack years of smoking, and she's like, yeah, you got like a 17 and a 13-year-old? That's like 30 pack years of children. It's like additive. So I'm like, great point. Nonetheless, why is it important? Point 10, foster resiliency. The healthier the leader, the sturdier the oars. The sturdier the oars, the stronger the ship. The healthy leader is practice what you preach. Everything you do, others are watching. The optics on what you're doing are much higher than they ever have just by virtue of the role in the title that you carry. Be the boss that you'd want to have. So getting to the end of our roadmap here, the well-balanced leader, IQ. You all have achieved much to get to where you are today. The EQ, own your mistakes, embrace that feedback. Don't push it away, embrace it. All feedback is valuable. And the VQ, ventilation perfusion, practice what you preach, right? Well-being is truly the key to healthy leadership, and it amazes me. I've spent time with executive coaches and other experts from like industry and business. They focus on the VQ. They don't call it VQ. I had to kind of like tell them, well, that's ventilation perfusion. Just forget about it. Just be healthy. Do things that you enjoy. It doesn't have to be exercise, but it could be other things as well if you enjoy reading, spending time with family. It's kind of the leadership triad, having all these things together. Back to our top 10 list, support those who you empower, embrace those challenging conversations, place yourself in others' shoes, the treachery of e-communications, actively manage that process of change, learn to listen. It's tough. We've been conditioned to not listen in so many ways by our training. Beware of halt, step back from those tags, always reasonable, transparent, consistent, foster that resiliency. And finally, the footnote, we'll end with this. I heard this just the other day. It's your eulogy virtues. You know, I mean, everyone's going to be around at the end of your chief year. It's not a eulogy in that sense. But at the end of the day, what do you want to be remembered for? How do you want your chief year to be defined? What will be your legacy as a chief and as a leader? Use the hammer when needed, but use it thoughtfully. It's a scalpel, not a sword, and always aim to inspire your teams. So hopefully we've hit on some of those key pearls and frame up the day. And it's really been a pleasure to see everyone. Really, really great to be back in person. I hope that you enjoy the rest of the day. Any feedback that you have, like me on Twitter. Yeah, I have like 11 people following me on Twitter. I promise you, if you follow me on Twitter, I will follow you back. So I'll look forward to seeing you. I hope you enjoy the rest of the day. Thanks so much.